Hey guys, so today I'm going to cover with you our infection control in service. This will be your yearly in service and your monthly in service for February, so we don't have to do the sick case conference. Um, what we're talking about today is infection control, and so I have attached the handouts to this email as well. It's one attachment, but it's three parts. The first page is just the handout. It's going to go over a brief outline of what we're going to cover. And the second part is actually a copy of our agency's infection control plan. And the third part is infection control policy IC.1. I did not copy all of the infection control policies. There's actually 12 parts to that, um, but it is available for you to view at the office. I am, however, going to touch on what each of those policies talks about in relation to our infection control plan. So our infection control plan, basically, the aim here is to reduce the risk of acquisition and transmission of healthcare-associated infections. So we want to reduce that risk or reduce the number of infections that are transmitted to our patients while they're on our service. Obviously, our goal here is going to be, sorry, more cell phone buzzing. Obviously, our goal here would be for our patients to have no infections. It's a lofty goal, but we know that's not likely. So our infection control plan actually does have a prioritized risk based on past numbers of infections, and it actually states that in the goals of our infection control program. And that is on the bottom of the first page of that infection control plan. It's actually listed right here. Based on previous numbers, the highest rate of infection we have is with our urinary tract infections. We have developed teaching that we incorporated into the patient's home folder, and all patients will be taught on UTI prevention at admit and throughout their CERT period to try to decrease those numbers. Going on from there, we would like to see a 15% reduction in those UTIs. After that, a 10% reduction in the incidence of upper respiratory infections, a 5% reduction in the incidence of pneumonia, a 10% reduction in the incidence of wound infection, and a 5% reduction in the incidence of flu per year. All of these are per year. Now, this is tracked quarterly, and we'll talk a little bit more about that as we go. The three bullet points here and the ways that we're going to reduce the number of healthcare-associated infections is all staff will follow hand hygiene procedures and standard precautions and utilize the appropriate personal protective equipment to decrease the risk of acquisition and transmission of healthcare-associated infections. So we talked a little bit about that. Actually, we talked a lot about it in our previous in-service on bloodborne pathogen exposure. So we cover those steps or standard precautions, so I'm not going to go back over them with you again. But mainly it's that you guys will obviously utilize good hand hygiene and the appropriate PPE when there's the potential or risk for exposure to blood and body fluids. The second bullet point it hits on in our infection control plan is that patient and family education will be provided and documented in the patient record regarding applicable infection control measures to decrease the risk of acquisition and transmission of those infections. So all of our patients are taught on standard precautions and infection control. There's also a handout for that in their home folder. We do go over it with them at start of care, but it needs to be touched on throughout the CERT period by the staff that's in there as well. Obviously, there are some patients that are going to be at higher risk for infections, those patients that have urinary catheters or wounds. We're really going to hammer those points home with those patients. So you guys really need to be educating those patients and their family, especially if the family is providing the care, the family's doing the wound care, the family is doing the IV. We really need to provide teaching and document evidence of that teaching at every visit. And so you guys have the handouts for those things in the home folder, so please be utilizing that. Please be doing that. It is on every patient's plan of care as far as teaching on infection control and standard precautions for our patients and their families. It's on every patient's plan of care as well that they will receive UTI teaching, so make sure that we are hitting those points with all of our patients. The third bullet talks about is all staff will be offered and encouraged to participate in the agency's influenza vaccination program. Our goal is to reach a 90% vaccination rate amongst our employees. We did not do that this year. We had 70, I think it was 76%. I've already pulled those numbers back in January and put that away for the year, but I would like for all of our, I would like for all of our staff to get it, but our stated goal is 90%. We've yet to meet that in the 3 years that I've been here as administrator. So we'll just keep trying. Hopefully, we'll get there next year. Um, the following policies and procedures will be implemented through the staff orientation and annual education. So we talked already, this is your IC.1 is our infection control program, and it outlines those. And a lot of those things are administrative regarding tracking and the OBQI process. And so I've hit the high points with you guys in those 3 bullet points regarding hand hygiene, center precautions, education, and the flu vaccine program. We talked about exposure control in January when we did our bloodborne pathogen. That's IC.2. Hand hygiene. We did have a hand hygiene in service a few weeks ago at case conference where we talked about our policy on when to use hand hygiene. And so we stated that before and after patient contact and every time your hands enter your bag, so that we would be using our alcohol-based rub. It is appropriate also to wash your hands. You don't have to do both. You can use one or the other. Now, obviously, if you get something on your hands, or if you have a patient that has C. diff, you can't use the alcohol rub. You have to wash your hands. So just make sure that you are following those guidelines that before and after every patient contact and before you enter your bag. Cleaning and management of equipment is infection control policy.4. We covered that as well a few weeks ago in case conference where you guys should be using your wax paper barrier. All things that are going to be going back into your bag are sat on the wax paper barrier, or you use that wax paper barrier to create yourself a clean field to do wound care or to provide IV care or any kind of care to the patient. We don't want to just trust, even though their homes most of the time are clean, we just want to make sure that we're taking extra precautions in using that wax paper barrier. Obviously, all of our equipment that's reused is cleaned with your microkill or your citrate spray properly and thoroughly before it goes back into your bag and after each patient contact. Infection control policy IC.5 is our policy on disposal of dressings. And so briefly we're going to talk about that. Our policy, we can do 2 things what our policy states. One of them is we can dispose of a patient's old used dressing by double bagging it and placing it in their household trash. So it doesn't mean you can just put it in their trash can. You have to put it in like a Walmart sack or a trash bag, close that up, and then put that in their regular household trash. You never just want to put it in there open because their families or little hands are coming along and reaching in that trash can, so we don't want to leave that out to expose them to something. You can also put that old dressing in a red biohazard bag and transport it back to the office and dispose of it in our biohazard disposal in the back. Blood collection, obviously, we talked a little bit about that too with the nurses when we did our nursing infection control in service a couple of weeks ago. When we talked about needleless systems and PPE when using blood draw systems in our bloodborne pathogen in service. You want to take special precautions whenever you are doing a blood draw for labs or anytime you're using a needle to enter the patient's skin. Obviously, you're going to use good aseptic technique and good nursing judgment. You're going to cleanse the patient's skin thoroughly with alcohol, allow it to dry. You never blow on it, wave your hand in front of it, just allow it to air dry, to dry in seconds. You're going to use good hand hygiene and wear gloves. You're not going to recap a needle because that puts you at risk for exposure. You should use your sharps container for the needle, and you should probably label that blood tube and put it in the appropriate hard case plastic container that's labeled as a biohazard for transport to the lab in your biohazard cooler. Disposal of needles we've talked about. Obviously, you have to use a standardized labeled sharps container. You have those, they've been given to you. And those things should be disposed of once they're full. They should be closed, locked, and sealed and placed in our biohazard container in the back room. Transport of lab specimens, obviously we just talked about that. You're going to put that blood tube or that urine collection, whatever it is, in that hard case plastic labeled biohazard container. Those are available for you as well. And you're going to put that in your biohazard cooler. Never, ever, ever, and you should put it in a, before you put it in those things, you obviously are going to put it in a biohazard lab bag. So it should never just be laying in your car seat, even the baggie. It should always be put, the blood vials or the urine should be put in the baggie, sealed up, put in the hard plastic container, sealed up, and that goes into your biohazard cooler for transport. Obviously, we're never just going to be carrying around blood tubes or even carrying around a baggie with the blood tubes in it. Those should always be put in something. Um, Always keep in mind that you're using aseptic procedures for any and every procedure, especially invasive procedure that you do, like a blood draw or a urine collection. So make sure that you're maintaining a good aseptic technique on those things. Um, we covered bag technique a few weeks ago. I'm going to briefly just going to touch on it today. We talked about a clean and dirty side of our bag. Now, nothing dirty ever goes into our bag. When I say dirty, I mean things that are multi-patient use, okay? You should have a side of your bag that are for single patient use, things like gloves, wound care supplies, those kinds of things. So if you use it, you're going to throw it away when you're done. So that's where those things should go in a divided bag. We've given you guys all bags, so make sure that you're utilizing that bag the company has given you because those meet their standard requirements for our policies and procedures. Things that are multi-patient use, I mean, I say dirty, but they're never dirty, are going to go in one side of your bag together. So things like your stethoscope and your blood pressure cuff and your thermometer, those things are going to go together on one side of your bag and never coming into contact with things like gloves or clean dressing supplies. So anytime something comes out of your bag, it's always cleaned before it goes back into your bag, even if you didn't use it on the patient. So if you took your pulse ox out per se, but you didn't check the patient's pulse ox because it wasn't indicated, then you're going to clean that before it goes back into your bag. Everything is cleaned before it goes back into your bag, whether it be equipment or your hands. So make sure that you are thoroughly cleaning your equipment with the right product. That has to be either our citrate spray or our microkill wipes, and those are provided to you. There's plenty of those in the back room, so make sure you're using those things. The last part of this infection control plan touches and talks about how are we going to evaluate the strategies of this infection control plan. That is done quarterly with our OBQI. Now, your responsibility for that is to fill out infection control, to fill out infection reports on your patients, whenever the patients have a documented or diagnosed infection. So let's just talk really briefly about that. If you are seeing a patient, this goes for nursing and therapy patients as well. Okay, some of our patients are therapy-only patients, and we know those guys get sick too of respiratory infections, those kinds of things. So therapy, make sure you're paying attention to this as well. Anytime you have a patient with a documented infection, and sometimes you may need to clarify that with their physician, you have to fill out an infection report. The option is right there in your note when you're doing the documentation, so please take this short amount of time it takes to fill that in. I'm not asking you to give me a book on there, guys. I'm just simply asking for what the infection is, what the treatment is, and if there's going to be any follow-up. And so this is really important. This is how we track the need to start this UTI teaching. This is whenever, so if I don't have these reports, if you guys aren't reporting infections, then we can't come up with ways to reduce our infections. And I know that our patients are getting infections, so I want to make sure that you are all doing that on all of your patients. That is part of our policies and procedures, so it's a required thing. So it's a really simple form to fill out. It doesn't take long at all, so please make sure you're filling that out so that we can get the most accurate data for our reports, and so we can make sure we're taking good care of our patients. I'm really hoping that with the incorporation of this new UTI teaching that we are going to see a decrease in the in that UTI infection rate in our patients. It's really important that we teach these patients, especially these ladies. It seems to be, one thing I've noticed in the trend is it seems to be more of our female population, which is actually the same way it is in the general population. Females are much more at risk for UTIs. So your responsibility there, guys, is to make sure that you are filling out those infection reports when our patients have a documented and diagnosed infection. Therapy, if you guys have any questions about that, please feel free to come see me or Cherie. We'll show you how to do that. Some questions I get, though, are, okay, well, what if the patient just says, oh, I have a cold? Do I fill that out? We're only going to fill out infection reports on patients that have a documented infection. So if they're self-diagnosing themselves, that doesn't meet the requirements for filling out that infection report. We have to have the documentation from the physician. So it's usually just a phone call, or obviously if they started on an antibiotic, that's obviously going to be evidence enough that they have been diagnosed by a physician. there's something else I wanted to tell you on that topic, and it has escaped me. Maybe it will come back. Um, if you have questions about that infection report, just please, or about that infection report that you have to fill out, just please come and see me. I think that's about it. Let me just take one last look. There is a section in here, I'm not going to go over that with you, about the plan for influx of potentially infectious patients. That's not something I'm going to go over. You have it with you. You can read it there on your handout if you would like to. So obviously that is about it for this in-service. I wanted to just go over those things with you. We have touched on bag technique and hand hygiene a couple weeks ago in our big group meeting there at the beginning of February. So if you have any questions about anything else that I covered, please feel free to come see me. I also need you to come by and sign the sign-in sheet saying that you have listened to this in-service. Hopefully this was a better way than having you all come in and sit for a meeting. So if you have any questions, come see me and come sign the sign-in sheet. Thanks, guys.